everyone, welcome to beautiful Lake Tahoe again. Sunset, one of the nicest times to be swimming out here. It is a little bit cold, about 50 degrees, so pretty chilly, but still really beautiful. Wanted to talk to you guys today a little bit about confidentiality issues when it comes to treating our kids and adolescents in our practice at Heritage Hills, because it's a topic that comes up fairly frequently and is very important for us to make sure that we understand completely and wholly so that we can treat your kid the most effectively possible when it comes to mental health problems as well as addiction problems. There's no difference between those two. Both have to be treated with the utmost amount of confidentiality and respect and privacy so that kids and adolescents have the capacity and the ability to be completely open, completely transparent, and give me the information that I need as a physician to help them move forward, as well as allow them to become kind of engaged in the decision-making process as well. That's very difficult sometimes for us parents to understand, and I am a parent, so been there, done that. I know what goes through parents' minds. Parents are thinking, well, I brought my kid in. I need to make sure they're getting the proper treatment. I need to understand what medications they're on. I need to approve the medications they're on. I need to understand what the risks and benefits are of the medications if we do any, as well as what else are we doing that's not medication related, like therapy, acupuncture, whatever, a lot of other treatments that are not medication related. So the short of it is this: parents, I always encourage our kids to be very open and very transparent with you guys, to have discussions about what is going on, what they're feeling, what's going through their heads, if they're feeling suicidal, down, up, if they're getting improvement or not on their treatments. I very strongly encourage kids to share any and all information they can with you guys after each visit. In fact, I always talk to them right from the beginning and I say, ultimately, you're here, the decision is yours, but you need to tell me what bone we're going to throw your parents. How are we going to explain to them what you're doing, what's going on, whether you're making progress. We need to choose a few things. We don't have to talk to your parents about everything that's confidential and kind of private of nature, but we need to pick things that we can present to you guys as parents to reassure you that we're indeed working on things, that we're hopefully moving in the right direction, that the benefits definitely far outweigh the risks. That's mandatory in my game when it comes to medications. We cannot and absolutely must not do medications unless the benefits outweigh the risks. So that's going to be really important. Let me give you a little run-up of how the first visit typically runs with us. In fact, the first visit, I very much insist on having the kids and parents, preferably both, divorced or not, in the exam room together so we can have kind of a common conversation and a common understanding of where things are and where everybody would like to see things move. This is a time for all of us to kind of do some data gathering, for you guys to give me the story, for me to really truly listen and understand what it is that's at your hearts, whether it's the patient or the parents, of course, and what your wishes are to see out of all of this. You know, sometimes they're dramatically different. The second and third visits, we typically then will do a combination where I'll meet alone with the kids and then we'll chat with the parents again as well. Oftentimes getting more information from parents rather than necessarily giving you information on what's going on. I try to build rapport and build trust with kids the first few times so they understand that what we're talking about truly is private and confidential. But again, like I said, at the heart of all this is to make sure that we honor the fact that this is a team effort. This is in no way kind of a solo thing, but they have to feel that privacy and they have to feel the ability to open up on their own, make sure I don't get hit by a boat, make sure they can open up and feel that they can tell me what's going on in their hearts. So who makes decisions on whether a kid or an adolescent? I guess we have to understand the difference between those two, and I'll circle back to that when it comes to ages, because there's a difference between 15-year-olds and younger than 15-year-olds when it comes to decision making. But who decides how we use medications in the first place? And I've got a couple of videos on that already. The basic understanding is we don't make any decisions on medications unless we feel that I have thoroughly listened and understood the entire problem, gathered all the data that I need from whoever, the patient, you guys, the parents, relatives, teachers, I don't care, whoever. Then and only then do we make the decision to go through the options, and then we talk about the options, and then the patient themselves will help determine sort of which options they want to try. And again, I've done a lot of other videos to talk about that whole process of deciding which medications are most appropriate and so forth. It's great to have parents in there because I like to go through the visual of describing how treatments function and how they work for people. Not just medications. Again, everybody thinks they're coming to an MD, a doctor, to talk about pills and pills. We talk about everything else as well. Pills is only one component of a possible treatment, just like a recipe. There's a lot more to a recipe than just salt and spices. We talk about cognitive behavioral therapy, alternative therapies, natural therapies. There's some supplementation that can help with kids, especially when it comes to self-harm, cutting behaviors that a lot of people do. So we'll be talking about all those options, and I'll draw that out very carefully, whether we do it on telemedicine. I use an electronic whiteboard now in the days of the virus, where we're meeting a little bit more distance. As you can see, perfect social distancing out here. There's not a soul around for about 100 miles. But we will talk about all those things very carefully. And so that as we go through this, not only does the kid understand, hey, this is exactly the pathway we're taking. This path is logical, it is methodological, it is sequential, and it is thoroughly thought through. And then we go down the treatment pathways that make the most sense, then the second most sense, then the third most sense, and we very systematically proceed through the treatment options. During that time, of course, again, my hope is that they will share as much with you, or better yet, allow me to share information with you guys as well. Okay, so that's my huge push in that first couple of visits, is you guys have full privacy, but let's try to share information with your parents. Tell me what you want to keep kind of confidential, and tell me what we're allowed to talk to your parents about, so that we can show them that we're being earnest and serious about making progress here. I think that's really, really important. So let's circle back to the ages. Colorado law states that anybody 15 years and older has full rights to privacy and confidentiality to seek mental health care. So by law, that's the age we have to honor. It's not 18, it's not 21, it's not whoever pays for the bills. It's that age, and the same goes for psychologists too, the therapists, they have to abide by the same rules and regulations. But that's just what that says. That means I have to work very diligently to make sure that kids understand that we do need to have a team effort going. When it comes to substances, so some people come in with only depression, anxiety. Some people come in with, depression, anxiety, and substance use, maybe marijuana use, maybe cocaine, maybe whatever, everything. The law there says that it has to be confidential after basically no age. There is no age. There's no age limit for confidentiality by law. Everything has to be maintained confidential. Doesn't matter if the kid is a 5-year-old sucking down marijuana. I have to keep that confidential if the patient desires that, okay? Heck, 10-year-old can check themselves into an alcohol treatment facility without permission from parents. That's what the law says. Again, my policy is always really, really hardcore. Let's get parents involved. Let's get loved ones involved. Let's recognize this is a team effort. The more team members you have on your side, the better. My preference with parents sometimes is to sit down alone in the future and talk to you guys about what it is that you can do to support your kid as he or she's going through this process, and what they need in terms of support and what that looks like, because sometimes it looks a little bit different than just the disciplining that we do as parents. And I know this all too well. Those are not identical things. And being a parent, holding consequences for kids' misbehaviors and limiting privileges and so forth for dysfunctional behavior, and at the same time still being loving and supporting towards them when they're going through this. That's a balance that we have to strike. So we'll spend quite a bit of time alone, and oftentimes I'll tell kids those sessions are really just for me to talk to you guys, the parents, to help you navigate those waters. It's not for me to spill the beans on what's going on with their lives. It's just that I tell kids, look, parents are afraid. We're all afraid for our kids. We just want the best for them. We love them, and we want to know what we can do to help them out. And it's just to reassure the parents so much, not so much as me telling them what's going on with the kids. So again, I reassure them of confidentiality there as well. The one caveat, of course, to the entire story is suicidal or homicidal ideation. Then the game is off. Then we bring in the forces to make sure that everything is safe and nobody is at risk of harm. So about communication, here's how this works. For the most part, we will provide better communication than you'll ever get out of any concierge practice, even though we're not a concierge practice. We have an app on the iPhone or Android that kids will use called HALE, H-A-L-E. They will log in. That will be their communications platform, unless they're under the age of 15, in which case you as parents can use it. Otherwise, it is theirs. Don't ask them for their passwords. I will constantly remind them that nobody is to have that password. You guys as parents can use our email, which is medquestion@hhfamilymedicine.com, and that is the email I encourage you guys to send us updates. Let us know what you're seeing from your angle. Let me know if you'd like to set up a time to talk. We can set up a visit to just chat about how you guys think things are going, to reassure you again that I'm here, that I'm listening, and that we're working diligently, carefully, systematically, and with purpose, not just randomly throwing pills at your kid. I am so not the let's throw a bunch of meds at your kid and see what sticks. That's not how it works. It's got to be very gradual, very slow, kind of unsatisfying initially because we don't see results right away, but that's okay. I'd rather take my time and ramp things up gradually while I get feedback from kids on the app that they're doing better or doing okay, and at least not getting side effects. That's the important part. So that pretty much covers the communications aspect of everything. For the most part, it works out really well. We just have to kind of figure out the flow and figure out the trust issue with kids. That's going to be paramount. And once we've got the trust issue, then moving forward is pretty simple. One last thing that I like to use to help us kind of communicate and keep track is we use an electronic signature program, kind of like DocuSign, that I send out questionnaires and consent forms and so forth. So be on the lookout for that. I will send them directly to the kids' email. And I'll also, if they're underage, of course, send out forms to you guys as parents on your emails as well. In addition, I'll probably send out some forms that ask for feedback on how you guys think things are going from an official standpoint. And I'll also send those same questionnaires to the kids periodically, as well, of course, consent forms so that I can communicate with their therapists. Talking to their therapist is absolutely mandatory. I will never work with a psychologist that does not communicate with me. There are way too many psychiatrists who couldn't care less about talking to therapists, and there are way too many therapists who don't feel they have the time to talk to doctors about medications or therapy progress. I have no energy or time for that. All communications have to be perfect, seamless, and willing, and rapid quickly too. Thankfully, most of the therapists that I've worked with in the last 20 years have figured out who's good and who communicates well. I'm happy to work with any therapist that you guys find out there. Open to anything. These people get my cell phone number, my pager number. They get every single number to get a hold of me, and vice versa too. So those consents will go out for those types of people as well, or anybody else that we need to talk to. Okay, school teachers, grandparents, etc. Whoever we need to. It's all a big team effort, guys. Listen, have a wonderful evening, and as usual, any questions, you pop in. We'll sit and talk about things. Okay. Have a good night. Bye.